I want to switch gears though now and turn to Jeanie Aloia. Jeanie is a registered nurse with Munson Medical Center in their medical procedure room, and she is certified in gastroenterology. I want to thank you for being here, Jeanie.
Oh, thank you for asking me.
Topic today, talking about colorectal cancer. March is Colorectal Cancer Awareness Month, and I think a lot of times people tend to stray away from this type of cancer when talking about it, but I want to talk about it today and first explain where this cancer is.
Right. Colorectal cancer can be anywhere from the sigmoid area of the colon all the way through, anywhere through the whole GI tract. And basically, we know that it happens because polyps form.
Okay.
And polyps are just a collection of cells. The cells turn into polyps that can turn into masses or tumors that are cancerous.
Okay.
And that's when that becomes dangerous and cancerous.
What about symptoms? How would someone know, oh, I think I should get something checked? Are there certain signs that a person will experience?
Right. Really, it's a silent kind of cancer. It is sign-free from the beginning. You could have rectal bleeding, you could have pain, but the idea is, since it is kind of silent and you don't even know you have it, it's a good idea to get a colonoscopy when you turn 50.
Okay.
Okay.
That's
because,
the general rule of thumb there.
Right. It doesn't discriminate. Men and women can both get it. It's a very treatable cancer, but the key is to come in for a colonoscopy, and the gold standard is 50.
50.
Age 50, yes.
Now, say you do have a family history.
If you have a family history, you would want to talk about it with your primary care physician. Usually, if it is in your family, people are recommended that it would be 40.
Okay.
Come in at 40, or we've taken care of people in their 20s. You know, especially if they're having any kind of pain or any kind of rectal bleeding, it's really important to come in.
And also, you know, I have some facts too that I want to go over right here. Colorectal cancer, the second leading cancer killer in the U.S., affecting both men and women, just like you said, Jeanie.
Correct.
And if you are at risk, if you had that family history, your risk does go up. Screening, obviously, highly recommended, which includes the regular colonoscopies.
That's correct. That's correct. I know I took care of a man once who was so thankful because one of the people he worked with had just died of colon cancer. And that's why he came in, and he said, and he had actually had a polyp, and he said, I really owe this to my friend. He never went in.
Really?
And he said, you know, it's so easy to do.
It really is. I'm going to say this. I've had 2 colonoscopies. My mother had colon cancer at an early age. They're not that big of a deal. They're a piece of cake. I'm just throwing that out there. And
well, it's true. It's true. The drugs we give are great.
I know.
And you
they
forget.
are. They're the best part of it. Jeanie Aloia, I want to thank you for being here. Very nice to meet
Thanks
you. I
for having
appreciate
me.
your information. Taking a look now at weather watchers. Here's Joe Charleboy.